Hello guys, welcome back to my YouTube video channel. Today I have a interesting case. I want to show you how my office to work. The first thing we do is we do the digital impression. We scan the case. If the patient is interested in having a consultation with the braces, we can start with the scanning and print out the 3D printing. And so I use the Medic 500. I print this out, and so the case is very simple, easy to explain to a patient. If the patient look at his or her jaw, looking at the upper arch and seeing her teeth is not straight, then we can talk about what we can do. Same thing on the bottom, the lower teeth is crowded, and so this is where conversation is simple and easy. The bite is registered by digital scanning machine. This is how her deep bite case is. You have a deep bite class 2 occlusion. The goal would be straight her teeth out and possible having 2 first bicuspids removed. All depend on patient choice. Profile will change if we have first bicuspid extraction and basically pull back the case. But patient so far in her late 20s, she doesn't want to have any tooth removed, so it's questionable that we're going to pull the teeth. But the other thing I want to show you this case is that she missing the lower incisor, could be tooth number 23 also. So that's what the problem would be. So show you the case, and want to show you that the advantage of doing the digital impression is that you can print it out and show it to the patient. Patient love to see how they look like outside, and they can actually touch and feel it. Wonderful experience for the consultation. No doubt that you cannot explain to the patient if you have the tool available like this. Thank you, and I will continue to show you how we're going to start the case today. Okay.